Hello, my name is Kimberly Rodriguez, and today I will be talking about attention deficit hyperactivity disorder, known as ADHD, and how it connects to public policy. So, the connection between psychological science and public policy raises important questions about how society defines disorders, utilizes resources, and decides when to step into people's lives. ADHD is a good example of how mental health diagnosis can influence laws and policies. ADHD is now recognized as a neurodevelopmental disorder grounded in research on executive functioning and self regulation. The scientific shift has shaped disability law, educational policy, and healthcare funding. In this presentation, I will summarize ADHD's diagnostic criteria, look at the evolution of public policy, and evaluate how policy responses affect individuals, stakeholders, and the broader societal well-being. ADHD is classified as a neurodevelopmental disorder characterized by persistent patterns of inattention and hyperactivity impulsivity that interfere with functioning and development. Symptoms include difficulty sustaining attention, disorganization, fidgeting, excessive talking, and impulsivity. Diagnostic criteria require symptoms to last at least 6 months, appear before the age of 12, occur in multiple settings, and produce significant quantifiable levels of impairments. These symptoms must not be better explained by another condition. So the diagnosis is not based simply on a person's having high energy or being easily distracted, but rather on how much those behaviors disrupt daily life and relationships. So let's imagine a student with ADHD, and this student is struggling with their focus and organization. Without support, they may be labeled as disruptive. However, with the diagnosis and a 504 plan, they can receive testing accommodation and classroom support. Often, this leads to better performance and confidence. This shows how policy and psychological knowledge work together to support individuals. So let's take it back. During the mid-20th century, symptoms were not viewed as medical or biological conditions. However, society believed that a child's inability to focus, their restlessness, and impulsivity was directly connected to bad parenting. Research on developmental and cognition reframed ADHD as a legitimate clinical condition. This led to acknowledgement in diagnostic manuals and educational policies. Disability legislation and special education law included ADHD under categories warranting accommodations. As ADHD has gained acceptance as a mental health condition, individuals have gained access to treatment and accommodations, which ultimately improve academic, occupational, and social outcomes. Now let's look at the benefits of families, educators, and employers. For families, acknowledgement reduces blame and provides pathways to support services and behavioral guidance. For educators are now able to extend accommodations such as extended testing time, behavioral support, and individual plans. Employers may provide workplace accommodation like flexible scheduling, which supports productivity and retention. Federal funding also plays a major role. Acceptance of ADHD has increased funding for research, school-based services, and treatment coverage, which can enhance long-term well-being and reduce risks like school dropout levels. One important policy is school accommodations for students with disabilities, such as IEPs or 504 plans. These supports can include behavioral help, counseling, and changes to schoolwork or testing. Public funding for mental health services and medication also helps families get effective treatment. These supports can lower long-term social costs like unemployment and involvement with justice systems. Policy advancements promote early intervention, improve quality of life, and ultimately reduce stigma. But of course, there's still going to be challenges, and some of those challenges can include misdiagnosing, limited access to care, and social stigma. In closing, ADHD shows how diagnosis can affect both healthcare and law in real ways. Research-based policies have improved access to care and support, but they need to stay ethical and evidence-based. Good policy should balance helping individuals using resources fairly. Applying psychology to policy is an ongoing process, and strong evidence-based policies help both individuals and society. Thank you for your time and attention on this topic.